This is HeartRhythmtv. My name is Janet Hahn, and today I have a wonderful guest with me, Dr. Dominik Linz, all the way from Maastricht University. Today on the Digital Health Channel, we're going to talk a little bit about PPG, because I think that everyone sort of understands what PPG is, but I think it's always good to sort of review to understand a little bit where it sort of fits in our landscape today. So welcome today, Dominik. How are you?
Well, thank you very much, and thank you very much for having me.
Great, wonderful. So let's sort of dive right in. I know that you wrote this amazing paper with your team called the PPG Dictionary. It outlined really well about what PPG is, but I think it'd be good for our audience to sort of have you outline a little bit, what is PPG exactly and how does it work?
Well, PPG is actually Photoplethysmography, so a very complex name, but a very, very simple technology. So what you actually need is just a light source. So everybody of us actually has a light source in our pockets, for example, the mobile phone, the flashlight. And this light source emits light into tissue, into capillaries, and the reflected light, based on the extension of the capillaries, actually more or less reflects the light again. And by this, you can get an idea about first heart rate, for example, but also whether a pulse is regular, irregular.
Right. And so I think that's what's important to sort of understand, right, is that we all have this on our smartphones. I think pretty much every smartphone has a camera and has a flashlight. Yes. And so pretty ubiquitous technology. Can you tell me a little bit too, can you actually get heart rhythm from PPG? Can you discern heart rhythm from PPG, or is it really just heart rate? And how does that sort of differ from ECG?
Yes, so I think one very important point is heart rate can be very accurately assessed. That's the first point. Heart rhythm can be also quite well estimated. So, for example, if you think about regular, irregular, it's very easy also to use different algorithms for PPG, but also just look at the raw data of PPG to see whether a heart rhythm is actually regular, irregular. Particularly if you already think that a specific heart rhythm disorder might be present in your patient, then already knowing an irregular rhythm or also specific coupling intervals, for example, in the case of premature atrial contractions or absolute arrhythmogenic rhythms in the case of atrial fibrillation, for example, where all this kind of information can be quite easily taken out the PPG signals.
So does that mean then that you do this on your smartphone, and does your smartphone actually tell you that you're in, let's say, AFib or SVT, or do you actually need to have a physician or a clinician still look over that?
Yes, so the PPG itself is not able to really diagnose a lot of those rhythm disorders. So, for example, if you want to diagnose atrial fibrillation, the ESC, the AHA, all guidelines actually at the moment still require an ECG documentation, meaning that PPG is not sufficient to diagnose atrial fibrillation. But for example, if you already have a patient who is already diagnosed with atrial fibrillation, then there are a lot of algorithms available in different smartwatches, in different apps for PPG, which actually can quite accurately detect atrial fibrillation. So importantly, the difference between detection in an already diagnosed AF patient compared to really a new diagnosis of atrial fibrillation where PPG is not sufficient at the moment.
Right, got it. Yeah, and I know that there have been some papers out of UCSF that have talked about sort of blending these algorithms a little bit with PPG and ECG to sort of increase the sensitivity and specificity. So I think those things are probably coming down the line pretty soon in our technology. And speaking of sort of that technology, I know that now we have so many sort of handhelds and smartwatches and everything that's sort of direct to consumer. And I know that we as EP love those, and we use those in our offices every day. So how do you think PPG still sort of fits in that landscape now that we have all those other technology that we can use?
Yes, well, there are of course already a lot of ECG-based wearables available where really an ECG can be recorded by our patients at home. But still, of course, not everybody has really this ECG device at home, but almost everybody has actually a mobile phone at home. And this was particularly also helpful, for example, during the COVID-19 pandemic. Well, we switched more or less our complete face-to-face outpatient clinic, for example, to teleconsultation outpatient clinics. This is what everybody, of course, did, and everybody knows what the challenges are. You call a patient without actually having rate and rhythm information available, and then it is very, very hard to treat actually patients with atrial fibrillation, for example. I think particularly in this setting, in an AF outpatient clinic setting, you have already patients who are diagnosed with AF, and then PPG technology is a very powerful tool in all hands of our patients to remotely assess whether a patient at the moment is in atrial fibrillation, yes, no, but also whether rate control in patients with more persistent atrial fibrillation episodes, higher burden of atrial fibrillation, whether rate control is actually efficient at the moment. And there, I think it's a very good way to use PPG at the moment, also for symptom rhythm correlation, for example. So not all symptoms in AF patients are really AF symptoms. This actually means we want to know whether symptoms in our AF patients are occurring during AF, and also there, apps assessing symptoms and rhythm, for example, at the same time. There, I think it's really a place for PPG at the moment.
Yeah, absolutely. And I think that that's how, we used it in our clinic when we were sort of in a pinch, like you said, in the COVID pandemic. We had our patients sort of download these apps and use them quite easily. It's, it doesn't take too much teaching to get people to sort of use the app on their phone. And I think, you use this, right? And you sort of disseminated this throughout Europe, right? In the Telecheck AF. So you want to talk a tiny bit about that? Sort of give us an overview of how that went?
Yes, sure. So Telecheck AF, so this was actually a project which we set up initially in Maastricht, but then also made widely available in a lot of centers, on all 41 centers in Europe. So the main idea was to make on demand a PPG app available at the time point when we actually had a scheduled teleconsultation. So meaning we just send a QR code to our patient 1 week before the teleconsultation, patient downloads the app and starts to use to collect PPG signals 3 times a day. All of this is sent via cloud to our hospital. And then we had actually the recordings of 1 week available just before teleconsultation. So this is Telecheck AF. And in total, we now have a lot of patients who actually have used this approach using PPG around teleconsultation. And we are currently collecting a lot of experiences of our patients, a lot of feasibility data, adherence data, and of course also whether this is really feasible and whether it can be really also be useful outside COVID-19.
Yeah, I was going to say, it seems like, I know that you guys have sort of spread this out during COVID, but in addition, it's been sort of used sort of in this pseudo post-COVID era a little bit as well, right? So I think it's there's continued use of PPG, even after COVID. For us, I know that it's been helpful in our patients who are sort of rural or can't always make it in for our AF patients in that respect as well. So, so I wanted to sort of thank you for coming on to the show and giving us this sort of brief overview of PPG and its uses in the landscape of EP these days. I want to also make sure that our audience, if you liked our content today and you like what's been going on FHRS TV, make sure you press like and subscribe. We're going to put a link to Dr. Linz's paper and his team's paper about the PPG dictionary in the description box below. So thanks again, Dominik, for coming on the show today, and hopefully I'll see you soon.
Yeah, thank you very much.